All right, welcome everybody. Somebody's been very kind and polite with their introduction. I'm going to show a little video to understand what's going on. I think this can help better than words sometimes. So this is your vessel, and you can see your vessel has got blood going through it. The side of the vessels, you have two layers, tunica, which is your clothing, inside and outside, and in between you have a muscle layer. That covers your vessels. In your vessels, you get blood, and all these yellow particles are your fat, actually your LDL. Many more LDL molecules or structures than red cells, billions of them floating. Most of these you make yourself. Some your diet does influence, and that's why diet is important. But genetics determine this. They slip through the walls of the internal coat, go into the muscle. And by doing that, they kind of slowly collect. As they collect, they become a plaque, just like your dental plaque. That plaque makes space. The space narrows the vessel. Narrowing vessels is the problem. Your artery wall, everywhere in your body, can do that. Towards your brain, towards your heart, towards your kidneys, towards the intestines. This is atherosclerosis, as somebody mentioned, which is a version of arteriosclerosis. The walls get stiffer with age, thicker, less oxygen goes through. Now, once fat builds up, your platelets get sticky. That platelets are kind of attaching your red cells. Red cells form a clot. This clot then further blocks your vessel. It's a thrombus. You heard the word thrombus. That's what that is. So that's basically the process. So some of you can turn that off now. So what I want to talk about today is, Samiji, you can turn that off now, Samiji.
Okay.
So what I want to talk about today is really, where does pranayama fit in? Now, clearly, we do know that diet is important. We know that exercise is important. Exercise, it turns out, even just 20 minutes a day of reasonable exercise, at least 5-6 days a week is enough to protect you. But you have to regularly. What I tell people is, after 20 minutes of sitting, get up and do something. Even if it's just going to the bathroom, pretend to go to the bathroom, sort of walk around the chair. Don't stay sitting more than 20 minutes. That's not healthy for you. When you do pratikaman, of course, that's fine. But in general, in life, you don't want to sit more than 20 minutes. So, but moving around is very important. That'll make your vessels more flexible. So even they get blocked, they'll be more flexible. Diet, we already know. I think we went over diet last time. The same diet applies. While you can control some fat in your diet by eating healthy fat like olive oil over and above other oils, or you can also talk about avoiding ghee, let's say, except perhaps sometimes when you're after fasting recovery. In some settings, ghee is good for you, but in general, dietary measures are, let's say, 20% benefit in terms of the fat you eat. That's because cholesterol is made by you, by your genetics. So it's your inheritance from your parents and forefathers. So realistically, while diet helps a lot, you do have to still attend to your cholesterol production. You may actually have some of those variables that are very common in Indian subpopulation that raise the apoprotein E is not the same as in Americans, and we tend to have higher cholesterol and lipids in general. So some of those are hard to address just by diet. However, as somebody mentioned, meditation can help. So there is data that meditation with pranayama will lower your cholesterol also. Again, these have 20-30% benefit totally. They're not going to make it to level you sometimes want. So make sure you check with your doctor, because you might well also need your medicines to keep it low, mostly because of genetic risk that you carry with you. So diet is very important. In terms of other activities that you can control, you can't control genetics, right? You can control somewhat by taking medicines, but otherwise the genetics of who you are. Other things you can control is sleep. It turns out that sleep is very important. So you want to sleep similar time every day, sleep for at least 6.5 to 7 hours, maybe more. People believe that as you get older, you need less sleep, but it probably isn't true. You need to get your sleep in. Sleep and a regular cycle seems to be very beneficial for your heart and your vessels. They get relaxation, they get less work, they kind of wind down, they sort themselves out, and you wake up and off you go again. So you need to give your vessels, your heart particularly, but your vessels also, that break. And that break, if it occurs regularly, your body sort of aware of it, the rhythms with it, your cycles with it, you sleep better, you sleep consistently, you're relaxed, very important. Another factor which meditation can help is stress. As we well know, stress makes your inflammation in your body higher, you're more inflamed, which means your vessels and the area I showed you get sticky. So your fat and your other cells, the platelets, get stickier. That's simply cholesterol and red cells and platelets because your cortisol, your stress is up. That is enough to make you very sick, just that stress. We can't avoid stress. We've got jobs to go to. Some are lucky, maybe you don't have to work, you have to manage your money. It can be just as stressful. Many of us have to work paycheck to paycheck. You listen to a boss, you got to keep them happy. Stress is part of life. You cannot avoid stress, but you can handle it. And so pranayama is very, very good. Meditation is very good for stress, as you know. It's one of the benefits. It gives a very positive outlook. All this has been studied. Particularly Pratyahara has been found to be specifically good at reducing negativity. In a study that some of you mentioned in young adults, we found that just 3 times a week, 20 to 30 minutes a day for like 8, 9 weeks, and the negativity, which is your controlling of your shocks and systematic issues that you see, dropped 20%. Your stress level dropped, your anxiety dropped. And that's all they did. And these are really not even people who knew about Jainism or meditation in the past. So very powerful techniques. So you want to kind of control your stress. So we talked about diet, and we can go diet again for any questions, but we went to it last time, and a similar diet is going to help. The similar diet for diabetes, similar diet for very similar. You talked about your exercise, and very important. It is absolutely important to exercise. Exercise comes even from our shastras. Very, very important to exercise. And do at least 20 minutes. That is a basic minimum daily. I would probably go once you get 20 minutes and get going every day, get routine. I would build on that. Don't worry about how hard it is. Even walking is fine. Of course, fast walking is better. But even if you can just walk, that's still fine. Then, of course, the third thing we talked about right now is your sleep. The sleep cycle is very important. That's, again, your choice. Sleep cycle is your choice. You decide, you determine, you set the clock, you turn off your TV or your cell phone. You put your cell phone away after sunset. Perhaps you want to sit for half an hour to catch up some weather or whatever important things, then put it away. All those things that stimulate you will keep you awake, your brain's awake, you're not even sleeping well. So you need to get this very, very nice routine going, right? Go to sleep at a set time. 20, 25 minutes variance is okay based on your other work that you're doing. Wake up at the same time before sunrise, very helpful. You'll get restful sleep, and that rest is very important, right? So now we've talked about those things are entirely in your hands. Nobody needs to change. It's just your control, your wishes, and you do it. On top of that, manage your stress. And that's, again, diet can help, we know, and we talked similar diets we talked about can help, but particularly powerful is this meditation pranayama. We found that when you meditate and you do these techniques as we did in these 8 to 9 weeks, many, many things in your body change. Not just the feeling better, which is very nice. You feel better, you feel alert, and you're more focused, but your system changes, your inflammatory tone. So your body has a tone. I'm this inflamed, this inflamed, this inflamed. If I'm stressed, I'm this inflamed. If I'm really angry, this inflamed. If I'm very, very greedy, jealous, and steal, I'm this inflamed. My inflammation tone is set based on what I'm thinking, I'm seeing, what I want, my desires is set. If you meditate, as I mentioned, which is what somebody's teaching you, pranayama is, of course, very good, you will lower that tone. So your basal level is very relaxed at every cell level. Within the cell, within the DNA, your DNA is switched off to a level where good DNA is active and the bad DNA, which you need for fighting and safety, you tone down because you don't need it. That's necessary if I'm fighting, necessary if something's happening outside the house I don't want to protect my family. But I don't live like that all the time. It's not good for me. That's only for flight or fright, not for regular life. Yet we're doing that regular life. We're constantly ambitious, constantly criticizing or attacking or looking at news and getting provoked by what's happening in a war that we cannot even influence. Instead of saying, I'll do it once a day and I'm going to turn it off. I'm going to relax because my mode, when it's relaxed, allows better blood flow to my vessels, better blood flow to the walls of the vessels, better cleansing of my vessels because there's no stress. My blood flow is smoother, my oxygenation is more effective. My vessels, which are elastic, can get back to elasticity before they get so fibrosed that they can't. Very important. Do it early, do it all the time. Now you've got all the tools to control this. These tools are all that matter. And if you do this early enough, you probably won't need medicines. If you do medicines, it won't be that big a dose. And you might even get breaks with your medicine. Not to say medicine are important, because if you look at Asians, particularly Asians that first went to England in big numbers, and now in America in big numbers, you see that their rate of cardiovascular disease is many-fold higher than the Americans, or the British, let's say. Their rate of strokes higher, particularly bleeding. Sometimes we bleed more than we clot more. So we do have a problem. And even after living here for generation two, the problem persists. It's not something that's improving as we, let's say, Americanize or become more like English. So if you look at the average Asian, and particularly Indians, the rate of unfortunately dying, having massive heart attacks at a younger age is very common. We get them 10 years earlier, and mostly more than one or two vessels of the heart are involved. Unlike our American friends who get it 10 years later, maybe one vessel is involved, so it's easy to kind of at least easy to fix that. When we get it, it's very hard to fix when we go to the hospital, very hard to fix. So we tend to have more deaths at the younger age. All you've known people at your friend circle, family circle, who've died at a younger age from heart disease. It's a big plague. And usually we think it's men. And in a sense, yes, men, but women also. Once you're at 60, there's no difference. Women have heart attacks just as much as men. Below 60 is more men. Strokes are very common. How many of you know somebody had a stroke? Very, very common. All these are entirely preventable. You can prevent them to a level where you put them off by 10 years or make them much milder or even just abolish them. You can actually avoid them. And these are the key we talked about. It's, of course, diet. Diet's very important. More authentic, more diet that's not made by man, not created by man. It's coming from the ground that you create yourself. The key thing to food is you start from scratch. The moment you take food that's off the shelf, that's prepared for speed, for efficiency, you know that they'd had to put things in it to keep it shelf safe. Important. Our fast life, I want to get my dough prep powder, I want to get this thing, I want to get my cereal box because I can eat it quickly. It's safe. It's got so many chemicals in there, so it doesn't get infected. The bacteria won't get, the insects won't go to it. I can eat it and not worry about getting sick. Well, guess what? You may be happy now, but you've just killed good guys. You've damaged your pancreas, you've damaged your other organs. So you're paying the price later, which is where we are. So avoid eating anything that you possibly can and slowly start that journey. So within a year, you're on top of not having anything that was processed by another man or industry. You've made it yourself. You've got it yourself as best you can. And maybe once in a while, once a week, you can take a risk. Once in a while, you go out, you can take a risk when you're traveling. But most of the time, you should be bulk of food should be you made it straight from the ground, straight from source that you created, you prepared, and you'd be safer. So diet is very important. Exercise is very important. It could be anything you want: swimming, playing piano, playing a music instrument. Simple things. It doesn't have to be complicated. You don't have to go to the gym if you don't want to. Even yoga will be good. You get double benefit. You get exercise, and you also, of course, get the other benefits. So make sure you stick to exercise. Do not get lazy. Do it. trying to avoid sitting more than 20 minutes, very important for many things, particularly your vessels. Your vessels are not staying stagnant. So your vessels are moving, the vessels like moving, and they don't get stiff. The moment I'm sitting, many vessels are stagnant, which it does not like, right? Very important. So these are very important take-home points, so make sure you focus on them. You will see many diets suggested, and that's fine. Try them. You see many things suggested that are good, and they're fine. Many remedies are fine. But don't rely on them as being your savior, right? Make sure you check everything, have regular visits to your doctor, make sure you check your levels and you stay on top. And do whatever it takes. If it takes medicine, take it, because you need to keep those vessels completely elastic. So you're smart, your brain's working, your heart's working at old age. You don't want that to be a problem. Biggest cause of death and strokes and injury in us at the moment. It's very, very big cause. So we need to really look at that. And it's all self-inflicted, unfortunately. Right. Now, finally, before I finish, one other thing I want to make sure we all think through is when we have illnesses that we know are definitely going to occur, right? The odds of us getting some of these are extremely high, right? We need to also educate our younger ones, right? So it turns out that even women in their 40s are now getting strokes and heart attacks. So nobody's immune in our culture. Nobody's immune. So you need to make sure that you not only practice this, you preach it to others, because every seems to be at risk. There's a high alarming rate of strokes and MIs occurring at that age that are a concern. Before COVID, it's not a COVID-related thing. This is something that's been happening for the last 15 years or so. So very important that not only you practice, but just like you preach religion to your family, so I preach other things, preach our heritage, preach our diet, preach how we were brought up, preach good food, but also make sure you realize that they also had risk. We thought you're immune till you get older, but it's not. It's starting early. It's been shown that your plaques that we showed start in the first 10 years of life. It's been shown that they build up the second decade. In your 30s, you can have MIs because your plaque's already there. And sometimes it'll break free and a clot will occur. So it's something that we should go back and fix, not just for ourselves, but our own friends, family, and next generation, because it's going to be also their problem. We now know that moving from India to America and 2-3 generations has the same risk. Just because in America doesn't seem to be enough to help them. We're not getting close to American risk. We're still carrying the high risks that we brought from India, where we came from. So it's very important we sell the message to everybody. These are such important public health issues because they affect us in such a bad way. So I want to take this very seriously, take note. Any questions, of course, now, later, anytime, I'm happy to ask. But please focus on those risks. Very important for you and yours. Finally, there's growing evidence that these things also affect your rate of dementia. There's more association with your vessels and dementia than we thought. So even the people who are getting old age dementia, that still seems to be partially linked by your vessels getting thick and hard. So that newer data makes it even more riskier than we thought. So please take heed of this. This is probably the most important talk you're going to get. And look at this very carefully and please apply it to your lives. Okay? Well, thank you, Mr. Miji. Thank you.
Thank you very much, Dr. Devendra. If somebody has any question with Dr. Devendra, please ask.
Yes, I have one question. The thing is that if the hardening of the vessel, what is the early symptom we can get? One question. Second question, what if if over thinning of the vessel, what to do? Sometimes we are a over thinning vessel, we give a too much thinning of the tablets, that what symptom will we get, and when you will stop that?
Yeah, so first, it's good questions. Both are very, very good questions. I'll try and help with both of them. First of all, the earliest symptoms are in fact none. That's the problem. So when we look at studies that show that you've got hardening or plaque forming in 10 years, 20 years of life, you didn't know anything that. We had to have fancy ultrasound Dopplers to pick that up, right, or imaging. So for the first 10, 20, maybe 25 years, 30 years of this developed disease, you will not feel anything. You will not know. That's why it's a sleeping danger that's going. And it's such a concern that literally everybody you know has it. It's just a question how severe it is. Very few people you know have escaped that. And it doesn't matter if you're slim or not. Slimness, helpful, but not protective. You could be an athlete. Again, it helps, but not protective. You could be playing, sport every day. Again, helpful, but not protective, because this disease has bigger factors than just those. But those things help reduce it. They won't cure you. So don't get fooled that I am running a marathon every week.
Yes.
You'll find marathon runners at 50 sometimes drop dead, right? It's unfortunately the disease is that bad. Smokers are worse off, but non-smokers are not that much better off. So you can't rely on those common things, which are very important. You got to do one step further. So the next question is, what's that one step further? Which is a very good question. We don't know how to reverse this. None of the medicines so far can reverse plaque, that we know for sure. There's hope that the statins could, but it's not been shown conclusively, and we're not sure that's real. So some studies that suggest that statins may help are probably not been fully vetted. So realistically, prevention is the only solution. There is quite likelihood, though, and there's a paper in American Journal that somebody's also mentioned in 2022, and the one before, which show that pranayama and yoga might help. And the reason it might help is it helps oxygenate you better. So there's a thought that your plaque's effect can be mitigated because you allow more perfusion oxygen and your vessels stay more elastic. So I've got a feeling that probably as we do more research, we'll find that proper pranayama yoga, where you do at least 5-10 minutes a day regularly for many, many months, you'll start seeing some suppleness, right? So even though the plaque is there, but my vessels are supple, they can still expand and contract and mitigate, means just counteract some of the problems. So I've got a feeling that truly I feel that we'll see that. And the reason I can say that also is our DNA and RNA changes we see with meditation are pointing that direction. They're pointing to better oxygenation and better control of scarring. Your scarring is down. So when you get thickening, hardening, some scarring going on, well, it turns out when you meditate into yoga well, the scarring tendency drops, inflammation drops. So I think you probably have the best weapon that our ancestors gave us for that, because nothing Western is actually cutting that back. Blood thinners are important because, as you saw, the platelets are sticky and they set fibrin, and then the blood clots, and the thrombus, is a final step to your attack. So my vessels are narrow, but to block them, I need either the tear in the vessel or the platelets clump the red cells and then block, right? And so blood thinners, we talk about like aspirin, are important when you have some disease, because that will stop that sudden block. My disease is there, but the sudden block suddenly knocks me off. I've collapsed, I have my stroke. So you need to take those thinners so that you stop that sudden block. All right, so ask the questions.
Thanks. Thank you.
Any other question?
I have a question. Dr. Devendra, thank you for enlightening us with some simple steps. Simple in it, we don't often practice it. So really appreciate that.
We don't.
I think the second question that the gentleman asked, which was about the thinners, these I mean, I've personally experienced it. I had a heart disease and I had a bypass surgery, and I was put on blood thinners, and Plavix, as you know, was recommended to take one Plavix every day until I started having internal bleeding. And then they started reducing it, said, don't take it every day, take it every other day.
Right.
The bleeding episode still occurred, even though after a while.
Yeah.
And then until you find this optimum dose. So with us Indians, the difficulty is that the dosage that the doctors prescribe here does not necessarily suit well with the Indian anatomy. I wish there was a way, I wish there was some medical research which says for Indians, this is not the right dosage, because they overdose you so much that until you suffer, you don't know. How do you prevent that?
No, you're absolutely correct. I feel that is the biggest plague, and I'll be, I'm disappointed that all the drug companies basically do studies on white white people, right? Because even though offered to many people don't volunteer. So traditionally, all data are from white men. The genes are different, right? As you quite rightly point out. And to your point, yes, we do have. Let's say when we have strokes, we have higher bleeding strokes than clotting strokes than the Americans. But the treatment is directed at the clotting. So we do get in trouble. I do think that medicines are not well trusted. So yeah, I don't know the simple solution except that perhaps you can bring it up, that like, do you mind checking what the problems are in India? So there is data out there. It's not great, but there are studies that are done by individuals, not drug companies, that will tell you that there are ranges you could use. So in the UK, for example, because the Indians have been there for so many generations, there are quite good guidelines, and they'll try and break it down to ethnicity much better than here. So I often, if I'm asked by somebody, I often go to the British data and NHS, and I'll find information there. Of course, India. So yeah, the only thing you can do is become wise as a consumer, realize that this is not studied on you, but you absolutely on the nail. Every medicine prescribed is either too high or not high enough. It's not correct. Even antibiotic doses, I've seen issues with. Even blood pressure medicines, which luckily now we don't use very often, but very common, used to make us diabetic. So there is a problem with that. I do know that the newer drugs now are going to study that. I think there are moves afoot. And of course, India is now very big. India's studies are getting stronger. Their research arm is getting much, much better and cutting edge. So you should be proud of them. They've done some amazing discoveries recently. And I think hopefully over time that the might of India will give us more data. But you're right. You absolutely hit it on the nail.
Thank
But
you.
don't stop the medicine though.
No,
Because
I
if you have
know.
a stent and you stop it, depending on which stent you've got, it'll clot that quickly. So don't while yes, you're bleeding and you have to control it, but some of the stents, particularly I don't know when your stent was put in, they are unfortunately will clot. So you need to be very careful. Don't take risks because they can clot and you'll be suddenly in trouble. So please be careful.
Yeah. Thank you, doctor.
So thank you very much, Dr. Devendra, for answering to the critical questions.
Samniji and Naminamastami, I have one question.
Yeah, you can.
Regarding underactive thyroid, you have a tendency to have a high lipid profile somehow. So is there anything you can do? Obviously, you need to control the thyroid treated. But generally, I find every time the results are higher in hypothyroid patients. What is your opinion on that?
I think we may do a session on thyroid at some point. I think we'll go in more detail. But in general, you're right that there are many factors in the binding of the thyroxine in your blood and how it distributes. And many factors determine thyroid. Even other people on this group also in thyroid hormone, and there are ways to interpret the levels that are difficult. But the problem with the thyroid is that because it affects every cell of your body, and it sets the tone for every cell in your body, you can't really not treat it because you will, even mental faculty will be slower and you'll be thinking slowly and you'll be deciding poorly and your decisions will be poor. So it's something that you have to work with. And just as a previous speaker mentioned, some of these things, there is no simple answer. You just have to work with it, get good at it, work with it, look at symptoms and go feedback to your doctor, because we realize that even the brand of your thyroxine and the company seems to make a difference. Sometimes you have to go to a name brand if you're getting in trouble and pay that extra. Sometimes name brand, this is where name brand can make sense for thyroid and some disease like that. You want to go to the expensive named brands because they're made in a more strict manner. And if you can afford it, which I would recommend, try that.
Okay. Thank you.
Okay, good. I think we should continue the next phase, but I'm happy to answer questions and please send me any messages. We'll make this a group and I'll be happy to help anybody in any way. Well, anyway, Samiji, thank you for the opportunity.
Bindi has also one question. Could you please ask? Yeah.
Oh, actually, I was just reading that if you soak aubergines in water and drink that water, that actually helps your cholesterol. Is that correct?
Yeah, so as I mentioned, there are many dietary, don't forget, food is your ally, right? Food is your ally. There are many things nature has to help us correct our problems. And so there are many factors in diet that'll help you. Fiber will help you. I'm fairly sure aubergine, I don't know that specifically, but I can only imagine that has some of these polyols and other agents which plants do have, and they'll help you. What I wanted to say is that try and go back to the original food, and you'll find those benefits, like the whole rice, not the rice you see, that's whole rice and brown. The rice that actually is from the husk, for example. Well, the husk and the rice has so many benefits for you because that's how we're designed, right? We were made to live and eat those foods, 1,000 years ago, and suddenly we change everything. So, but I would be careful about assuming that therefore I'm fixed. Does that make sense? Do that as an adjunct additive, maybe reduce your doses, but don't do it in competition. Don't think that I've done my meditation, I've done my running, I've listened to Dr. Mehta, I've done all this, I'm fine. That's just percentages. So somebody presented data that 5.7% reduction, right? That's just 5.7. That's not, you're still 94% in trouble. Does that make sense? You still have to work through the rest of it. So don't get fooled by people saying that this helps somebody because it doesn't work. It only works at 5–10%. I may be enough that 10% is enough for me, but for you, it may not be enough. So make sure you don't get fooled by that. Try that, use all those, but don't assume they're going to be all that you're going to take. Does that help?
Yeah, absolutely. Thank you so much. And now one more thing here. So in the UK, they also talk about the cure risk, that if it's less than 10%, then you're not at risk. Is that what they use in you?
Similar. Humans are the same everywhere. I think it's similar. However, given that you are heritage as high risk, it's no point taking chances from data. You want to do the opposite, right? You want to maximize and you live in a way that you protect you. And if you do that, your others in your family will do the same. So I don't think that we are beyond just looking at ourselves. We're looking at our whole family and friend circle, right? We have to influence others. You're here because you're interested. Imagine how many of you are not even interested, don't care, running around, that don't even know, right? So when I teach somebody, I give them responsibility to help others because that's my goal in life. So you want to practice it, even if you think you don't need to do it, live it, and be an example to others. Because I think so many Indians I see, so many of our family members are, it's just it's a crying shame because it's all preventable, right? And so the data is ridiculous, millions every year, just ridiculous amount of data. It's far more than any other crime is self-crime, right? Lack of awareness, knowledge, and then not applying simple rules to your life. Very, very important message. So I hope that you practice this even if you're safe, because it's better to show that this is the way to go.
Right. Thank you so much.
All right, good. I think Krishna Bhai is ready to start, so I'm going to sign off.
Yes, thank you.